Hello, I'm speaking to you from outside Minehead Community Hospital, as you may gather by the sound of seagulls in the background. We've just had this month's board meeting. We're really pleased to be back at Minehead Hospital, not least because Exmoor Ward has now reopened, which is great news. You'll be aware that the ward was closed towards the end of last year on account of staffing problems. We've now been able to recruit to a number of those vacancies and the ward has reopened. I'm also really pleased to inform you that Nikki Mayer has been made the interim matron covering both Minehead and Willerton hospitals, and I'm sure she'll do a fantastic job. During this month's board meeting we received a variety of updates. You'll be interested to hear that in response to the Grenfell Tower tragedy, the Estates and Facilities team have done a lot of work to ensure the safety of our buildings across Somerset. So we received an update in relation to fire safety, and I'm pleased to report that we don't use any of the cladding that they had at Grenfell Tower. We received a report in relation to medical revalidation and appraisal. It's one of those things that we have to check on an annual basis. And likewise we received a detailed report regarding infection prevention and control. And this is an area where the Trust has done some fantastic work of late. We've seen some real improvements in the terms of how common we have outbreaks of both Clostridium difficile and also MRSA infections. And a big thank you to our small infection control team, and of course all staff across all our inpatient units who do so much great work to ensure that patients don't acquire these infections. We received an update regarding the Milverton branch surgery consultation. You'll be aware that the Trust is now running the GP practice in Wiveliscombe, and there's a small branch surgery in Milverton, and the consultation in relation to the future of that branch surgery is currently ongoing, and actually I'll be attending a public meeting in relation to this in early August. In relation to the South Somerset Vanguard, that's the Symphony Vanguard, I'm pleased to report that the Trust now is working very closely with colleagues from primary care in South Somerset and also YDH in relation to developing enhanced models of primary care across South Somerset. And I think this demonstrates our commitment to collaborate closely with all key partners across the county, and not just with our colleagues at Taunton and Somerset, and you'll be aware of some of the developments in relation to that collaboration. A couple of final things to flag up. Firstly, we received the final CQC report. This is the first time that the board received the detailed CQC report, and obviously the board was very pleased to hear that we have now been rated good, and obviously the plan now is to move to us becoming an outstanding organisation. And finally, this was the first board meeting that Sarah Oak formally joined us in her capacity as the Trust's interim medical director, and that was a bus going behind me, so apologies for that noise. So that's it from me. We don't have a board meeting in August. The next board meeting is in September, and obviously I'll produce a podcast following that. Thanks a lot. Bye.